Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
What is an aortic aneurysm?
An aortic aneurysm is a dilation of a blood vessel or a ballooning or expansion of the blood vessel. In this case, the aorta is the biggest blood vessel in the body that brings the blood flow from the heart to all of the other parts of the body. And it can expand over time and the wall weakens, and that's called a dilation or an aneurysm.
What makes an aortic aneurysm simple or complex?
A simple aortic aneurysm is one that involves the aorta below the kidney arteries, where there are no branch arteries that are important. And a complex aortic aneurysm involves the critical branches, which include the kidney arteries, the intestine arteries, the arteries to the arms or to the brain.
How is an aortic aneurysm diagnosed?
Often an aortic aneurysm is actually found incidentally, meaning it doesn't cause any problems for the patient, but on evaluation for other types of problems, it can be found on imaging studies like X-rays, CT scans, MR scans, and then sometimes in the case of very large aneurysms, a patient or a patient's doctor can actually feel it as a pulsatile mass in the abdomen.
What are some causes of aortic aneurysms?
It's thought that an aneurysm results from abnormalities in the wall of the aneurysm that causes it to weaken and then expand or balloon out over time. And it can occur as a result of genetic predisposition, smoking, hypertension, high cholesterol, and other vascular risk factors.
What are some consequences if a person has an aneurysm?
It really depends on the size of the aneurysm. Ultimately, what we really worry about is that aneurysm getting so large that the wall is weak enough that it can rupture and cause internal bleeding. And that's usually, unfortunately, something that will lead to death if that occurs.
When does treatment begin?
Generally, what we say for simple infrarenal aneurysms is that if it's less than 5.5 centimeters in maximum diameter, it's safe to just keep watching it. Whereas if it's in the more complicated areas where there are those branch arteries, we usually wait till it's about 6 centimeters before fixing them. But the key is that they need to be watched and carefully followed for the rest of the patient's life.
How often should a patient follow up and be checked?
Generally, what we say is if it's less than 4 centimeters, we'll see them once a year. And if it's greater than 4 centimeters, as they're getting closer to that threshold where they may need repair, we'll actually see them every 6 months.
So what are the treatment options?
Generally, there are 3 options. One option is to do nothing, and that's often not a very good option because if we watch it indefinitely, the natural history is that it will rupture, and as I said, that can lead to death. The second option is an open repair, which really was first begun in the 1950s and has evolved over time, but it's still a very large operation where we have to open the belly, we have to move all the intestines out of the way, and we replace that entire area of the aorta that's affected. And then the more newer treatment involves minimally invasive repair using endovascular stents, which are metal lattices that have fabric on them that you can reinforce the aorta from the inside with a stent graft. And that's generally just done with 2 needle holes at the groin arteries or 2 small incisions at the groin arteries. So this is actually an example of an aortic endograft, and there are many different types, but you can see that it's got a metal frame and then a fabric lining that's impermeable to blood, so it channels all the blood flow through this tube so none of it can get out to the aneurysm. Over time, that just becomes a big bruise now without any blood flow going to it, around it, and the aneurysm will just shrink down over time.
What is the recovery time of the different types of procedures?
With an open aneurysm repair, and it depends on the complexity, but I would say at a minimum, patients are in the hospital between 5 days to 14 days, then often need rehab for several days to weeks to get their strength back. And really, it's out to around 3 months or even to 6 months before they start feeling totally back to normal. Whereas with a minimally invasive repair, they're often in the hospital just overnight, or for more complex repairs in the range of 3 to 5 days, in which case they then go home and usually are at their normal level of activity within 1 to 2 weeks.